Hello everyone, welcome back to my YouTube channel, and this is another video of my series of video interviewing, having a conversation with my peers, my general surgery residency at Larkin Community Hospital. This time I have a pleasure to have a conversation with Dr. Feras Othman, and the next thing that we're going to do is pretty much ask Dr. Feras, who are you? Tell us a little bit more about yourself and about your experience as a physician now. How did you get to come from your country to US to do the surgery residency?
Got it. Pleasure is mine first. Thanks for having me in your channel. It's a great honor to me. I'm Feras Othman. I'm from Jordan, but I was born in Kuwait, lived all my life there. I finished my medical school in Egypt, and then I did couple of years of training in Kuwait in general surgery department. I also did my internship there, and then I did my USMLE exams, and I was so lucky to come to the United States to do a prelim years initially at University of Miami, and then I'm here as a categorical at Larkin Community Hospital and Delray Medical Center.
So that's awesome. That's a very interesting pathway to become a general surgery residency. But you make it sound so easy. You make it sound like you know like this and this and that. But we would like to know a little bit more what happened behind that pathway. So for example, when you graduated, you did medical school, and then what make you decide to come to the why did you choose I want to do my surgery residency in the United States? And what did you start planning when imagine yourself 5 or 7 or 8 years ago, and what was your plan? Okay, I'm going to do that, I want to do this, I want to start studying, I want to improve my CV. What were the things that you started doing at the beginning, just as a newly grad medical school?
Sure. So the thing is, I knew the fact that in Kuwait, where I live, I will not have a chance to get into a residency program because I'm not a citizen of Kuwait. Let me silence my phone. I'm sorry. I'm not a citizen of Kuwait, so the residency program basically there is only for citizens.
Oh.
That's number one. Number two, being United States as a surgeon has been my childhood dream. You know, nobody can make it, or almost not anyone can make it. It's difficult. It's a road full of challenges, obstacles. Sometimes you will have a people telling you that's almost impossible. It's gonna take a long time. You are getting old. You have to establish a family. So I did not listen to that. So the thing started when I finished my medical school. The first thing is I wanted to do step two to apply to Qatar. I was looking for an ACGME accredited program, and Qatar has one of them.
Oh, interesting.
So I did my step two exam, got good score, and I applied to Qatar. So the thing is, being away from your family for 6 years, I was studying in Egypt, and the medical school there 6.5 years. So, I fed up of being away from my family and my friends. So the dream of going to United States was fading a little bit slowly and gradually. So I did the steps, went to Qatar, and they found me like I'm a little guy. I was just like 25-year old, not ready, and it was the first interview in my life. I did not have the experience of interviews before, so they put me in a waiting list, and it was like a little bit shocking for me. So I remember I was talking to my friend, my childhood friend, and he told me, Firas, you're like really clever and intelligent. Why don't you do step one and expand your dream? Instead of going to Qatar, go to United States. So literally, I got the step one books within 1 week of that conversation, and I did my step one in the same year. I studied for step one for 8 months or even less. And now we have step three. At my time, we need to do CS. CS exam. But when I applied to the visa, they declined the visa. Again, I was so small, they thought that I'm gonna like migrate, so immigrate, I mean. So I did not get the visa for almost 5 years.
Wow.
Yeah, for 5 years. So at that time, I was full of ambition. I'm an ambitious guy. So I opened the road to different country, like prestigious country, like Germany and United Kingdom. So I learned the German language within a year. I mastered the language. I did some electives there. So I was on the road to go to Germany. On other hand, I was doing the MRCS exam, Membership of Royal College of Surgeons in England. So I was opening like two choices to me, and I worked in both countries. So everything, it's by coincidence. So what happened is I wanted to visit one of my friends in Jordan. So I went there. I did not tell anyone of my family there in Jordan that I'm going to Jordan. So I will not be distracted from my friends. And when I was in a restaurant, I saw my cousin by chance on the next table. And I was telling him this story like I'm trying to go to Germany or United Kingdom. I wanted United States. It has been always my dream. But he told me like, why don't you apply as a citizen from Jordan for US visa? I did it, and here I am
Wow,
after 5 years.
that's a great story. I mean, and does bring me to, one of the things that I always tell to all the IMGs, because all the IMGs sometimes are very concerned about the timing. No, they want to do everything quick. They are always thinking in, oh, I want to do in 1 year, 2 years, 3 years. And it's not about time. It's about when is the correct moment for you. Sometimes the life will show you when that moment
Exactly.
is. Before I came here, I tried the same. I tried in Germany, I tried in Spain, but at the end, I went back to Venezuela. I did my residency there, and now I'm here because different
You are in the
situations.
best country actually in
I
surgery.
am exactly, and
Yeah,
and this is the time that I'm supposed to be here. So the time for you will be there. So don't focus on the plan. Focus on being the best you can be, and the time will put you in the specific moment that you need to be.
true. So if you're lost in the middle of nowhere, like let's say in a rainy forest in Amazon, so what is your priority, the direction or the time? So it's the direction.
Direction
You
completely.
have, yeah, you have to know what is your direction first before timing. If you know your direction, you know what to do this, then everything will be fine. And everything is for your own sake. Usually I remember like why I spent long time doing that and that. It turned out to be to my own advantage. Like I have very good CV, I have a lot of experience. You can see that when I'm discussing medical stuff with you guys. And it does not come from like just out of medical school. It
Correct.
takes good experience.
Okay. So my other question is, uh, knowing that in Latin American countries, for example, it's very hard or difficult, or it's not common to have tutors or mentors that kind of guide you in the medical school or even after to tell you what you're going to do after you graduate, right? It's
Hmm.
not very common, and I see that here in American is very common. Americans are used to have that tool. So, do you have that tool when you were looking for all these opportunities? Have you have mentorship or tutors that help you out? Do you think that would be better for you? That would
Of
improve the
course,
timing?
of course, I'll tell you something. So when I applied to residency program, first time I applied to categorical spot. I did not know what is the difference between categorical and the prelim. Okay, so first time I applied to categorical spot, I did not get it. Second time I applied to another categorical spot. I I get some interviews, but again I was not accepted. Third time, my friend told me, Firas, you are IMG. You should apply to a prelim position. you cannot apply to categorical position for like in a country that you did not work in. So get some experience and let them know you. And if you're good enough, they're gonna give you a categorical spot. And here it is. I applied to a prelim. All the positions that I applied to prelim, I got double the interviews. I choose University of Miami because similar climate to Kuwait, and I was good in the first year. They give me another year. I was super good. There was no open position for the third year, and my program director, Dr. Mosri, had me in his program, and I'm so thankful for him.
No, we're very thankful for having you to on our program had an open spot with because one of the residents left, and we have this open position, and we were really happy to have you because he's one of the best residents,
so
and he's
much.
one of in the country. He's one of the best. The resident that has the highest scores on the app side, which is one of the is the in-training exam an exam that we take every year
It's like
to
a
kind
board
of
exam.
assess your progression in your surgical skills and knowledge. So we're very proud of having you in our program.
And also, I'm proud of you.
Thank you. So my next question, because you're once you were in a preliminary year, I want you to talk a little bit more about that, because a lot of people that are just applying now, they don't know what is there any do you feel there was a difference between the preliminary year first and second year and the categorical first and second? Were you treated differently?
Mainly yes. Mainly yes. I will tell you. So for those who are watching us, I advise you to apply for a prelim position. Even if your scores is like in 270s and 280s in USMLE, apply to prelim position. This is like, the program director usually says that I cannot take someone whom I don't know.
Correct.
Okay, so prelim is a chance for the program director to know you more, and a chance for you also to know the program. And if you don't like it, you can change either the specialty or either the place. So my prelim year, for someone who has been stuck in Kuwait for a couple of years, having a prelim is like a dream. I cried when I matched.
Of course.
I cried from happiness, man, tears of happiness. So I started like as a regular person who comes from overseas, and the thing is you need to work double the categorical people, because the eye is on you.
Correct.
Okay, so I'm gonna take him or no. So you have to work double. You have to score the highest so you can set yourself apart. And we have been treated a little bit differently in terms of rotations. So we were doing mainly as a prelim and as a BGY1, mainly floor job. However, there are rotations for categorical that has been designed for more operative stuff. Like, for example, the categorical people, they have a month rotation, a 1 month rotation of doing only simulation lab. So they sit on the rope, they sit on the laparoscope, just a month of doing all the simulation stuff. We don't do that as a prelim. Also, they had the chance to do surgical oncology at University of Miami, where there is no fellow there.
Oh, okay.
Okay. Me, I had to do surgical oncology at Jackson. It's a one campus, that,
Yeah.
but different buildings. So I had a fellow there who was taking everything.
I guess.
So they were telling us like, hey, in surgical oncology, you're gonna get 40 or 50 cases as a BGY in this month. But actually, I got like maybe 1 or 2 cases.
Oh, I see.
Yeah, because the 30 or 40 was in the other campus.
So this is something important for you guys to know. There's always more chances for you to match as an IMG in a prelim position than in a categorical. Of course, you can apply for both. Actually, when you apply, it's the same. You pay once, and you can apply for both at the same time. You don't have to pay like double. So if you paid a fee, let's say this hospital has two positions that you pay once and you apply for both. Okay. The thing is that when you apply for both, they will take you automatically to the prelim instead of the categorical because you are IMG. So those places that has only categorical, like Larkin, you only can apply for categorical because we don't have uh, prelim years
It's like because we are a small program.
because we're a small program.
Yeah.
So that's another thing that I would like to know because you have been in two different programs, very, very different. So you have been in University of Miami, which is a very big academic program. Is one of the biggest programs in the country. And you have been in, you're now in a community hospital, a smaller hospital, different way to work, it's completely different system. So
Yeah.
could you explain to the people a little bit more about your experience and things that you like from one and things that you don't like from either or? Okay.
Yeah, I'll tell you. So, University of Miami, it's a big center. It's very, very busy hospital. You know, Jackson Memorial Hospital. I believe it's the biggest hospital in the nation. It's like over 1,500 bed, not even more now. So the experience from all the residents that I have perceived, it's like it's hectic, it's busy. You should come at 5 a.m. Oh, sorry, not you should come. Like the work starts at 6, but you have to be like an hour area so you can round on the patient, you can start the stuff with the attending, and then you can go to the OR. So as you said, it's academic program, so everything will be done under supervision. You know, like you cannot take a stitch without an attending beside you, single stitch. That's the downside of it. Like you'll not have a life, even if you have a perfect balance between your social life and your scientific acquisition. It's still difficult to make it because you need to wake up at 5, I say, as I said, and you have to come and you have to tolerate the pressure of the service. You know, for example, in vascular, we used to have like 40. The regular patients is 40. Okay, in Rider Trauma Center, you know, how big is it?
Yeah.
Uh, we don't rest. Like every half an hour, there is a trauma alert, and like we have many ORs. We sometimes take patients from the ICU. So it's busy. It consumes your energy. You go home and very tired. Sometimes you don't have the energy to study or do anything. You just want to sleep. Okay, and this is actually what I have experienced, and I just want to stay in the bed. I don't want to go out. But the transition from big program for 2 years to go to a smaller one. So I thought initially like I'm gonna be ruined, and you know, it was like a shock to me. I did not.
You're not gonna learn. This is gonna be
Yeah.
different.
So it was hard to me to adapt initially. You know, for someone who came from a big program with the good academic base, and you know, like we do a lot of first stuff. So you know, the good academics. So I remember that my techniques were not that good as a BGY3. So the focus here in community hospital is how you improve your techniques, because at the end of the day, you're gonna operate. You will not sit just explaining the surgery and explaining the patient. You need to operate. You need to do, you know, how to do your stuff. So third year was like a significant focus on my skills. Like they taught me how to do the laparotomies, how to go layer by layer, how to put your fingers. Um, Also, they taught me how to do the perfect stitch. Even if I'm a little bit like, I'm not slow, I'm a little bit meticulous and safe, so I know where I put my stitch, so I'll not injure anything. So these skills, these fine skills, I developed them in the community hospital. It was like a huge change. Plus, we had people who are already surgeons like you. So I remember that when I did my first trach, I did that. I poked the trach multiple times, but I did not get it. So I had Jesus telling me, no, you have to grab it, have it between your fingers, and put the needle in. So that's very good to me. You know, even I'm like in the hierarchy higher than him, but he has like a good experience in his country. You know, So it helped a lot. Like we are surrounded with people who are not only like a residents, but they are experts in their field at all levels, like residents and general surgeons. So I feel like I'm lucky, and I was chatting with my friends, telling her that I'm so happy at my program. I don't think of changing it. I had a chance actually to go to a bigger place, but based on the experience I had at UM, I would like to stay here and do my cases, keep improving, and keep having a proper learning curve in
That
terms of surgeries. Yeah,
that's amazing. One of the different things that I believe is that when you start talking about hierarchy, uh, our program, because it's small, we treat each other more as a friends than as a hierarchy. Like I don't care if you are PY 4, 5, or 1 or
true.
2. It's like we all the
One
same.
family,
It's
one
one family.
family.
We're
Yeah,
all the same. And when we are on call here, it's only one person. Like you are by your, so it's you are the PY 1, 2, 3, 4, 5 the same day.
true.
So everybody, it's at the same. So we have to take care of each other. In the other programs, because you have more people at the same time, you could use more the hierarchy thing, and okay, you do this and you do that, and you can feel more. I believe that than here. So changing the topic now, because I always explain to the IMGs, especially that networking is extremely important in
Of
order to
course,
get anything in your life, not only a position as a surgeon or a new job, but to get any kind of opportunities to open doors. Networking it's one of the main tools. So, have you? What do you think about networking? What do you think about connections
I'll
in the
tell you.
U.S. systems?
It's not only in US system. It's everywhere, even in Venezuela.
Correct.
It's everywhere. So when I got to United States, I'll tell you. So I had my friend, okay, who had a cousin doing a fellowship at UM. So I told my friend, please talk to your cousin at UM to talk to the program director to have a look at my application at least.
Mm-hmm.
He did that. The program director had a look, and it turned out that there are many people who graduated from UM worked in Kuwait. So I was speaking to them to speak with the program director, and the program director then emailed me, told me like, hey, we're gonna set an interview and we'll talk. And he started asking me about the mutual friends that we had. And after we finished the interview, I spoke to one of his closest friend in Kuwait.
Mm-hmm.
Okay, I told him like, please talk to him, email him again, because I need that position. Even it's prelim, it's gonna open the doors for me in the future.
Exactly.
So he talked to him. He told him like, hey, he will never disappoint you, blah blah blah, and like he got me. That's number one. Number two, when I uh, when I finished from UM, Dr. Masri knows me, but I had a friend there who's Ahmad. I told Ahmad, please speak to Dr. Masri, push for an interview. And once Dr. Masri spoke to me about like a proposal, like, hey, do you want this position, blah blah blah. I spoke to Dr. Freeman, who's a friend of Dr. Masri,
Mm-hmm.
and pushed to take me. So it's all about networking. It's not only scores, it's not only the CV, it's only networking. If someone knows someone like really close, they will get you to this position no matter what is your scores or what is your
Correct.
CV.
That's extremely important, guys. You need to work in your networking skills. You need to good, meaningful connections, because the only way that Dr. Sliman could have recommend you to mastery is because you build a connection with him. You show him how valuable you are, how
Yeah.
good resident you
He does
are.
not want me to go back to Kuwait.
Yeah, so
He
it's
wants me to stay close.
you also you don't need you're not going to ask somebody to recommend you just for free. You have to show them. You have to be reliable, responsible. You have to build that connection, and you can build that connection in person. You can build that connection online. There's so many resources now that there are available that we can talk about it later. But I think that's very important. Uh, Another question that I always ask, and we're getting close to finish, is what is your support like? Because sometimes this could be a very lonely pathway or journey, and and with some ups and downs, and we need somebody to support. a partner, friends, family. So how is that important for you? And how do you think we should approach that area?
So it depends on everyone's personality. For example, you cannot live without your wife or without your family, you know. Me, I
Correct.
cannot live without my family, but at the end of the day, the future is very important. Your family will not stay forever for you, you know. So the support system that I have is through my mobile. Every now and then I open the FaceTime or video and speak with my parents, like every 3 4 days, and I keep in touch with them. I speak with my friends. I have them around me on Facebook and WhatsApp, and that's like when I'm at home. I have a friend at in Miami. Actually, they come every weekend to visit me, and we usually like do BBQ and uh, walk in. Like I have a huge garden at my house, so we walk and enjoy the scenes there.
That's nice.
And if I need like you guys as a support system, also like if I need something, I can speak to you. I can share my thoughts. So it depends on each one's personality. Plus, I like cinema. So whenever I have a chance, I go to cinema. I like swimming. Whenever I have a chance, it's just 2 minutes away from my house. So I go there and swim. So actually it depends like what do you like and what do you need in your life.
But I think it's very important now because I mean, this is you have a life besides the hospital, and you need to at some point it could be a stressful life. Resident life is very stressful at some times, and you need to kind of free that energy, go to the gym, go to the cinema, go to walk outdoors, talk to family, kind of doing all these things, and also having somebody to support you is very important. For your pathway to everything is like in life is about relationship. Now you can see a TED talk that talks about why the people usually live longer and happier. One of the main things that they found is that those people who have a close relationship with connection with people, those were the people that usually last longer because
Of
they're not
course,
alone. So
you
it's
have
very
peace of
important.
mind at least, you
Exactly.
know.
So it's very important to have that connection. So to finish, to wrap up this conversation because it has been very nice. Uh, what advices did you give to all these IMGs? You know, they want to become a surgeon in America,
Not only
and
surgeon, maybe they want to be a medicine as well.
yeah, they want to be a physician. Let's say a physician, no?
Yeah.
But what would you recommend? Three or five tips, whatever, any number of tips that you can give them, the things that you believe help you a lot and could help anyone.
Number one, don't give up. Don't give up. Like if you believe in something, don't give up. That's number one. Number two, surround yourself with positive people. Don't surround yourself with negative people, even if it's like negative people from family. Try to avoid. Surround yourself with people who can push you beyond your boundaries and beyond. You know, so it can keep going. You can keep going on. So that's actually my two advices, main advices. Third, as Jesus said, focus on your networking, focus on
Mm-hmm.
your social skills, focus on your resume, which is your CV. I mean, the scores, the research. If you have any chance to do research at your place, do it. Because at the end of the time, if you want to talk to someone, that guy need a good CV so he can talk to his friend. That's very important.
Correct. Well, I think that's pretty much it. Thank you very much, Dr. Feras
Thank
Othman.
you so much, Jesus.
PY4 of general surgery. It was a
Thank you so
pleasure.
much. It's a
Thank
great
you
pleasure.
guys. If you like this kind of video, please, or you have any other question, you can put it in the comments. Please like and subscribe to my channel and see you in the next video.
Good luck, guys.
Bye
Take care.
bye.
Bye.